Hello, I'm Dr. David Alleman. We're going to talk a little bit about dental bonding agents. We're going to talk a little bit about how to choose a dental bonding agent. We're going to talk about what a gold standard bonding agent might be and what techniques are important to make these dental bonding agents effective. And so dental bonding agents have two important differences. Each dental bonding agent has a primer and an adhesive. And if you separate those bonding agents, it's much better. If you mix them together, and that's called a simplified bonding agent, then it's a little bit faster. You gain about 30 seconds, maybe a minute, but you may lose 10 years of bonding performance by using those simplified agents. So we don't recommend the simplified agents. All of the gold standard agents have this separation of primers first, and then adhesives second. So that's the first thing to choose in a dental bonding agent. Separate the primer elements from the adhesive elements. So that means they're two bottle systems. Sometimes they're called three-step if you have an etching, conditioning, and then a priming, and then an adhesive, or a two-step where you would just have priming that starts a self-etching and then adhesive that covers the priming and polymerizes the priming. So one term that is used in the literature is a gold standard designation of bonding system. How does that happen? Well, they first use a test. There are several types of tests: a shear test and a tensile test, a microtensile test where you're pulling the composite off of the bonding system, and that's the gold standard test. There are other tests that are more sophisticated, but this microtensile bond test is the gold standard. But the real gold standard above the in vitro test, which is that shear test, that microtensile shear test, is clinical trials. And the clinical trials have to be controlled for the shape of the cavity. And the only cavity that really has that ability is what's called a non-carious class 5 lesion. So if you have an abfraction that's not carious, it controls for C factor, and all of a sudden it's not chewed upon. And so we have the ability, without retention form, to judge different bonding systems, how they stay bonded in these retention-less, these cavity preparations that don't have any retention form, don't have any resistance form. And so they're just relying on the bonding to stay into this defect. And so these non-carious class 5 lesions are a gold standard to judge how one bonding system performs over 5 years compared to another. Now we have 15-year studies that have designated gold standard bond systems that do much better, 30% better than other bonding systems that are usually called simplified or universal bonding systems. And so the techniques, for example, of whether you use an etch or use a self-etching system, and how you apply the primers with agitation or without agitation, how you apply the adhesive. If it's too thick, what's the downside? If it's too thin of an adhesive, what the downside of that is. Other techniques you consider besides your bonding agent is what the foundational condition of your tooth is that you're trying to bond to. And the two most important pathologies are caries and cracks into dentin. If you ignore those, then that foundational bond that you're establishing, that hybrid layer, under function will start to peel from the crack or the decay that's underneath that adhesive layer. So you really need to own the procedures that you're using with your bonding agent. And we can help you do that. We have some educational programs that can help you master your bonding systems, your bonding agents. And we invite you to look into those. We have a podcast that can also give you information about this essential topic in adhesive dentistry and foundational in biomimetic dentistry. Until next time, stay bonded.